So let's talk about the actual patient interview itself. So what does the traditional workflow look like? Well, I'm either memorizing what they're saying, I'm jotting it down on a paper, maybe I'm typing it. Either way, I'm not making eye contact, I have split attention with my patient. I have to hope I remember everything. I hope I document acuity properly. If I have to get collateral, I have to do that at some point. I have to document it, at some point finish my note. It's kind of a nightmare. So let me show you the much better way that we do it. So we get consent from the patient to record. And of course, if they don't get consent, we can still use the same interface. You can hit a little dictate button and afterwards you can dictate. So you can use the system either way. And then of course, as I'm talking to the patient, it will have a live transcription. So along the top of the note there, you can see exactly what they're saying. I've even had times where I didn't even understand what the patient was saying, but the AI actually understood and I was able to read the transcription and actually have a better interaction with my patient. And of course, it's filling out the note live as I go. And I can skip redundant questions. I can't tell you how many times I've had patients coming and saying, I've answered that question 3 times. Why are you asking me that question again? So when a patient does an intake, and let's say that they've done a nursing assessment, I already know how they've slept, if they're doing drugs, what their social history is, all of that. I can now dive deeper into things that are actually relevant to my conversation instead of covering the same things that the patient has already talked about a bunch of times, which also makes the patient a lot happier. I can capture collateral immediately. So I can record the phone call. I use this a lot with child and adolescent. I talk to the parents. It will summarize everything that we talk about. So I can be busy working while they talk and it'll just fill it right in my note. And if you remember earlier, we had these patients who were color-coded by severity. Now, when I click on the patient itself, the reason why they're severe will also be read in the chart. So I know, is this because of suicidality? Were they agitated? Were they not sleeping? So it's very clear from my note why they were severe. And so I can focus on that. When I'm done, I can actually verify the full transcript. So I can read everything that the patient said to me. A lot of times I've had disputes where patients said, I did not say that. I can actually pull up a transcript and I can review that. And additionally, if doctors, let's say, miss for some reason why the patient is severe, let's say that they were suicidal overnight, they were read, but for some reason, the doctor missed that. They will actually get a warning in their notes saying, you did not talk about this very important thing. So again, we just have many fallbacks just to make sure we're doing great work every single time. AI also makes suggestions, and these are non-intrusive. So things if you want to maybe change your mental status examination, if you want to consider a different diagnosis, if you should do something different with medications. Again, non-intrusive, if you don't want it, it's not going to bother you. But if you want it, you can dig deep and have all of those AI suggestions down. And of course, I always export my note by the time I leave the patient's room. So my documentation is done. And it is stellar documentation. So not only am I getting it done fast, but it's incredibly high quality.
Schedule a demo today to focus on what matters most with Psynk AI.